So for the next enzyme which we are discussing, we'll talk about an enzyme which is known as the adenine adenine phosphorybosyl transferase. So for the adenine phosphoribosyl transferase is as follows. We call that the APRT. This is APRT. Okay. Adenine phosphoribosyl. So what this is used, we say that it's an enzyme and it's involved in purine metabolism. Okay. And we study these enzymes because they are important in a lot of pathways. And most of the times when their levels are low, you have issues. Okay. So it converts adenine into adenosine monophosphate. So this helps to recycle purine so that they are always available for energy production. Adenine will be converted towards adenosine monophosphate here, which could become ATP, that's energy. So the enzyme there is adenine phosphoribosyl transferase. So if it is deficient, adenine is instead converted to 2,8 dihydroxyadenine, which crystallizes in urine and it damages your kidney. Okay, so genetics. If there's mutations in it, it's actually autosomal recessive. Shows you that for you to have deficiency of this enzyme, two of your parents must have the issue, okay, or must be carriers. So types, sometimes the enzyme is completely absent, sometimes there's partial absence of the enzyme. That means it's very small. Okay. So if somebody is having a reduction in the level of that enzyme, they have a lot of kidney stones. And those kidney stones are not visible on x-rays. They could be so tiny, you know. So there are other things like the person will always be having urinary tract infections, the person will be having blood in urine, the person will be having a lot of stomach pain, nausea and vomiting. Okay. And if it's a baby, if you want to take out their diapers, it will be reddish. Okay. And later on, they can have chronic kidney disease. Sometimes they can have end stage kidney disease later on. So the disease is mostly common in Japan, in Europe, in Iceland. They diagnose it in using all those urine microscopy, stone analysis. You know, they also measure directly to see if the enzyme is reduced. So treatment include all those allopurinol, the first line therapy. It will dissolve the stones. It will make it that your kidneys will start functioning and producing urine again. Other drugs like febuxostat. Okay. So other measures like you take a lot of fluid, water, just pure water. Okay. And you know that you can't really process purine. Your body can't really process purine. So the amount of purine you should be taking should be reduced. That one, your doctor will actually advise you on the foods based on your location.